Okay. All right, good evening, everyone, and welcome back to another session. Today we have Dr. Sweeney joining us, and she's going to be teaching us all about general dentistry. So Dr. Sweeney, the floor is yours.
Hey guys, so I just want to say thanks so much for having me, and to Desiree and Kathleen for Grupa for organizing all of this. I think it's awesome what you guys are doing, especially during this time when I know it's really difficult to get into an office and actually shadow. So super happy that I can be here. I'm really honored that you guys asked me to come on. So feel free to ask me any questions that you guys have. I know we kind of have to wait till the end, but whatever you guys have questions, concerns on, feel free to ask me. I'm more than willing to answer anything because I was in your position not too long ago. So, but yeah, my name is Renee. A lot of my patients either call me Dr. Renee or Dr. Sweeney typically. I am a practicing general dentist in Miami, Florida, and I graduated from the University of Pittsburgh in 2019. So I have been practicing for about a year and a half now. So you can go to my first slide. Perfect. So yeah, as I said, so I practice in Miami, Florida. I have a little bit of a unique situation that I've been practicing for about a year and a half, but I've worked in private practice for a more corporate office, or what people call as a dental service organization. And I've also worked / work for a nonprofit. So I've kind of seen a lot of different routes of dentistry and, what makes each one unique. So right now I work for a company called Pacific Dental Services. So it's what they call a dental service organization, or what people think of as a more corporate practice. It basically runs as a private practice, but the company handles all the business ends of things. So in my office specifically, we have 2 doctors, 2 hygienists, and about 3 assistants that we're trying to hire more. So we're not too big of an office, but we're a very busy practice that's been in place for about a year and a half now. I also work for a nonprofit organization called Caring for Miami. So it's a mobile dental unit. I started out by volunteering with them and just loved it so much that I actually work there 1 day a week, seeing patients who are uninsured or under the poverty line. And we provide basically all free dental care to those families and those individuals. So I get kind of the best of both worlds, and it really breaks up my week and makes everything very different. So they also asked what my favorite procedure is. So I would say anything that's more cosmetic related. So crowns, veneers, things like that. I really love to see the transformation in people's smile that you can achieve through some cosmetic procedures. And you can skip ahead. Perfect. So my route to becoming a dentist, I went to college at the University of Pittsburgh, studied nutrition and dietetics. So not too unique, but I didn't go the route of studying bio or things like that, because for me, I knew bio and chemistry were part of it. And while I enjoyed it, it was not something I loved. So I wanted to study something I really, really enjoyed, which for me was nutrition and dietetics, and loved it. It gave me a really unique background that I still utilize now with my patients, in terms of how their diet really affects their oral health, because a lot of people don't really think about that interconnection. So it gave me a really unique basis that I still get to utilize now with my patients. So my GPA was nothing insanely stellar. I was not a 4.0 student, but I had about a 3.6 GPA. My science was about a 3.4. So it was relatively average, maybe a little bit on the higher end of the science average. I'm not exactly sure what all the schools are looking for now, but if you guys haven't already, definitely pick up, I believe it's by the ADEA. They do a whole basically summary of all the dental schools. It gives you the breakdown of what they look for GPA wise, DAT wise, things like that, just so you can kind of get your bearings on schools that you want to apply to, what's kind of in your range. I know I use that, and it was really helpful for me to kind of narrow things down from the beginning to even figure out where I wanted to go or what was possible. For the DAT, again, had a pretty average score. It was good, but I had a 20 overall, 23 PAT. Again, at the time I was applying, that was considered very good. I know like 19 to 22 was considered, pretty solid score for most schools. I'm not exactly sure what that's at now, but just to kind of give you guys a range, I was not the absolute top of anything, but I was a very well-rounded student. And what you'll find for dental school is typically what they're looking for most of the time. So I used to study for the DAT, just to give you guys a breakdown for those of you who are studying for it right now or might be in the near future. I did not take any Kaplan course or any specific course because at the time when I was doing it, I was paying for everything myself. So I was kind of going the very budget friendly, savvy route. So I used Crack the PAT, which to be honest, I actually felt was harder than the actual DAT. It prepared me really well for chemistry and organic chemistry. I had just taken it as soon as I finished those classes and used the Chad's prep videos, which I believe are still free. They were free at the time. And then I bought the Kaplan Blue Book for Bio. Kind of went through that because bio is very, very wide ranging, but they had practice questions and practice exams in there. So that's one of the main reasons that I bought it, and would definitely recommend when you guys are studying for that, take as many practice exams as you can and time yourself, because that's really helpful. And that's where you'll really get your bearings on that. But moving on. So for shadowing, again, I know it's a little bit different for you guys right now with everything going on, but trying to shadow, in whatever way you can. So whether it be doing these presentations and things right now or reaching out to anyone. I know some other dentists are kind of doing other versions of virtual shadowing where they're allowing people, via webcam to kind of see things, but just trying to get out there in whatever way you can is really important, not only just for your application, but also to make sure it's something that you like, because dentistry is an awesome profession, but it's not for everybody. So definitely making sure that it's something you enjoy the environment, you enjoy, the lifestyle of it and things like that. I had about over 100 hours of shadowing, and I mainly shadowed general dentists because for me, I wanted to see, since that's where you're starting out in dental school, regardless, before you can specialize in anything, you have to be comfortable with those procedures first. So I knew for me, that's where I wanted to start out. And then from there, kind of see what's available in terms of specialties. So I did most of my shadowing with general dentists. So even if you know that there's something you already like, definitely make sure that you're kind of covering across the board in specialty and general dentistry, just so you have that knowledge and experience when you go into an interview. For extracurriculars, so this is kind of where the well-roundedness comes into play. A lot of times that dental schools look for. So for me, I was on the Division I dance team at the University of Pittsburgh. So I was involved in athletics, research, which I don't know if every school requires, but I know oftentimes schools require it. And for me, I was not a big lab person. So I didn't do the very conventional lab work, but I worked in a nutrition lab where we worked directly with patients. So I got to have that patient interaction, which I loved, and was really heavily involved in their weight management research and stuff. So it doesn't always have to be the typical research that you might think of, but there's so many opportunities out there. Again, just finding something that you like, you'll be a lot happier doing something that you enjoy versus just doing something to write it on your resume, I promise. Clubs, again, I wasn't involved in a huge amount of clubs, but the ones that I was involved in, like the dietetics or nutrition club and pre-dental, I was very involved in. And I think that's what schools also look for, is that you don't have to be involved in a million things. It's kind of quality over quantity on that. And then same with volunteering, they definitely look for those hours, but finding things you enjoy doing, and it doesn't have to be dental related. I don't think really much of my volunteering prior to dental school was involved in dentistry at all. But I was really passionate about what I did volunteer with, had done some mission trips, things like that. So that gives you more to talk about in your interview as well. These are all the things that kind of set you apart and give you more to, I guess, set yourself apart, or more to talk about in your interview. And people can tell when you're passionate about something. So I also had a job or multiple jobs while I was both in college and dental school. And it's something that, again, shows that you can handle a very busy schedule, that you can handle doing different things. So yeah, it just definitely helps there. Something that was unique with my experience as well is I only applied to 2 dental schools, which is very risky, obviously. But again, I was paying for everything myself. So I kind of really weighed out the benefits and risks of it and knew where I wanted to be. And, it worked out, thank the Lord. But yeah, I know it's different for everybody. Some people apply to a ton of schools. Some people apply very mid-range, and some people do what I did and really only apply to 1 or 2. So just seeing what works for you, what's best. Because I know applications can be, unfortunately, very expensive. So yeah, just again, that book by the ADA really lets you see what schools are looking for, what's the range, and what might be attainable for you. Just thinking about location, what those schools have to offer. Just do your research for sure on those schools, so that way you're not just willy-nilly paying for a bunch of applications to schools that you might never want to go to. You can go to the next one. Okay, so what is general dentistry? I know most of you guys have probably heard this quite a bit at this point, but the great thing about general dentistry is it really allows you to pick and choose what you want to do. So you can do pretty much anything within the scope of what you learn in dental school, anything from oral surgery, implants, to orthodontics, prosthodontics, perio, endodontics, or root canal. So, with working at a nonprofit and an office, my range of what I do differs a little bit at each, which I'll get into in the next slide, but I do a little bit of all of this. Right now, I'm not placing implants. I have the training and ability to, but I want to go through a little bit more training before I start doing it. And again, it's an area where anything you don't do is where you get to rely on the specialists even more so, and they're always there for that. So it's really picking and choosing what you like, what you feel comfortable with. So I think that's the beauty about dentistry is you can pick and choose what you like and what you don't. If you hate doing extractions, you don't ever have to do an extraction. There's specialists for that. If you don't want to do a root canal, you never have to do that. Or if, there's some that you like, but you don't feel comfortable doing extensive procedures in that, that's perfect. That's what the specialists are there for. It's there to utilize and refer it to them. But like I said, you can really pick and choose, especially when you have your own practice. I know some people who really only do, veneers and braces in their practice, and that's just what they have kind of marketed themselves to and tailored their practice to. So, it's nice that you have that freedom of really making your career what you want it to be. And go ahead to the next one. So advice for college. I kind of went through a lot of this stuff, but maintaining good grades and DAT scores, because honestly, that's what gets you the interviews in the first place, is looking good on paper. I always say that to people, everyone before they will ever meet you are looking at you on paper. So you have to, meet that certain criteria for them to even consider you there. And then, once you get those interviews, that's really when you get to let you shine. So on paper, the academics and then everything else that sets you apart. So whether it be the volunteering, clubs you're involved in, research, and especially your letters of recommendation, those are all the things that help boost you if maybe you feel like your academics aren't as, high as you want them to be. But so letters of recommendation, with that, everyone is typically going to have good letters of recommendation. Most people are not going to write you something bad. And if they do, I apologize, because most of them should tell you beforehand if they're not going to write you a good letter. But definitely always trying to find a professor who really knows you well, not just someone who is known for being the best in the department or a really noteworthy professor, because like I said, they're never going to write something bad, but it makes a big difference to interviewers when they read a really detailed letter that can really talk about you as a person, really speak to your characteristics, speak to experience, different things that you've done, versus the other person who's just saying, yeah, they were a great student, they got an A in my class, they came to class. It speaks volumes when you have those really personal letters. So really trying to connect with some professors, some dentists. I know, again, different schools require different letters. So seeing what they require and finding those people who really do know you. And if you feel like you don't have people that you're close to, just try and make those connections, whether it be, going to office hours more often or just getting to know a professor. They enjoy getting to know students. So don't be intimidated by it. I know it can sound scary trying to get to know someone, but, at the end of the day, they're just another human being that really probably wants to get to know you. They enjoy making those connections. They went into teaching, for a reason. So don't forget that. And then kind of what I already said, just really do your research on schools before applying, whether it be location, what they have to offer. One thing that I wish someone would have told me when I was applying to dental school, because I never would have thought about this, is specialty programs that places have or don't have. So there's pros and cons to both. If a school has a lot of specialty programs, it's great because you will get to see all the specialties. The downside of that, though, is you often, as a dental student, might not do as many of those procedures because they're going to the other residents in those specialty programs. For example, if your school has a oral surgery residency program, you might not get to do as many surgical extractions or things like that you maybe that, or I should say, compared to other schools that don't have any specialty programs, because they don't have other residents and people to refer those to. So just something to think about. Again, it doesn't mean it's a bad thing if you go to a school that has all the residency programs, and it's not a good or bad thing if you go to a school that has none. It's just something to think about in terms of the clinical experience you'll get, what you're looking for, if you're looking to specialize, different things like that. So just talk to people, find out what works for you. And I think I kind of already touched on those other things. Oh yeah, go ahead. Yeah, so like I said, advice for dental school when applying, the cost that's involved, the cost of the schools themselves. We all know dentistry and dental schools are very expensive. So, finding what works for you. At the end of the day, no one there, it really doesn't make a difference what school you went to in terms of you're going to be able to get a job. As a dentist, most people aren't typically comparing what school you went to versus the other person. It's, they're usually looking at your personality, your confidence, their clinical skills that you have at that point. That being said, there are pros and cons to every school. So finding one that fits you well, whether it be cost, location, programs that they have, the amount of students that are in a class. I know one thing that was very important to me is that in my class, there was enough seats for every student in the clinic because I wanted to make sure that I could maximize my time in clinic. So that was really important to me, trying to save as much money as I could in terms of the cost of my program. So those are all things, just to think about when you're applying to dental school, because like I said, it is very expensive, but at the same time, which I'm going to talk about, is there's ways to pay for it. So a lot of people are really fearful of the price of dental school. And while it is a lot, there's definitely things that can aid in that, whether it be scholarships, some of the different programs, for example, the Army, Navy, and National Health programs, when you apply to them, they pay for your school. You are required to serve a certain number of years in their programs, but that is a great way to have your dental school paid for or partially paid for. So there's definitely things that are available that you can look into. There's other, scholarships offered by different schools for academics. I had a partial one for athletics. So there's things out there. You just have to do your research on it. And then again, different loans that are available to you. So it's not something to make or break your ability to go. If you know that dentistry is really what you want to do, don't let the finances of it terrify you. And then biggest thing people always ask me is, what should I do once they get into dental school before school starts? And I always tell people, just relax. You've in the app, like once you get your application in, like you've done what you can. Just kind of relax knowing that you put your best self forward, and whatever the outcome is, if it's something that you really want to do, keep pursuing it until you get there. But once you know you get that acceptance, just relax and enjoy it that time before you start dental school. So like I said, I work for both an office and a nonprofit. So at the nonprofit, I see about an hour appointment for each patient. So I'm seeing a lot less volume of patients, but we're typically doing a lot more procedures per patient there. Do a lot of comprehensive exams, a lot of extractions, root canals, crowns, bridges, dentures. So like I said there, I'm doing a lot more procedures myself just because patients are lower income and they don't really have access to care elsewhere. That being said, I still refer procedures out when it's something I'm not comfortable with or I feel like is beyond what I'm willing to do. But I do a lot more root canals and some more extensive extractions and things like that than I would at my normal office for sake of volume, price and just time that I have there. We also see a lot of cancer patients there. So it's a really neat environment to be in because I see a much different population than I see at my office. So we are linked directly with one of the hospitals. So all of their cancer patients get sent to us. So we help get them prepped, get all their dental work taken care of before their procedures. So it's, like I said, it's very different environment that I work in compared to private practice or even a corporate office. It's really unique, but I absolutely love it. I love being able to serve my community and that population of people. So it's a really neat program to be a part of. And there's a lot of places like that that exist if that's something you're interested in. I also, like I said, work in an office. It can be pretty busy. We have the two doctors, like I said. I see between 6 to 10 patients, sometimes a lot more, sometimes less than that. Just depends on the day, what is scheduled and what we have planned. And in my office, we do a lot of CEREC, so the same day crowns. We do in office a lot, inlays, onlays. So we get to use that digital technology to mill out our crowns, which is really neat. A lot of patients love that. And we do a lot of same day treatment, getting patients out of pain in and out of treatment. So it's nice to be able to offer that. Patients really like it. Okay. So again, I get a very wide range of patients and populations. So at my office, typically see about 20 to 40-year-olds, a lot of middle class, some kids, some older population, but we're very much, just because of the area that our office is in, we are in a much more young professional to early professionals, middle age population. So we see anything from emergencies, patients in pain that need root canals or extractions for same day treatment, cosmetic cases, people who come in with jaw pain or TMJ issues, cracked or missing teeth, and oral pathology. So again, very wide range of stuff, but it allows us to have a very varied day, which I know that's one of the things I love about dentistry is your day never looks the same and your schedule is always changing because when emergencies get added on. So it really keeps you on your toes, and it's fun and an exciting environment with everything that comes in. But yeah, it's nice to be able to, you might have a crown one minute, have a extraction the next, have someone that's coming in for jaw pain that you're making them a night guard and need some Botox. So yeah, it's really neat, and we can get more into that if you guys have questions, anything specific related to that. So again, the procedures that I perform, veneers, crowns, bridges, implants, anytime someone is unhappy with maybe the size or shape of their teeth, maybe they're missing a tooth, anything that's more cosmetic. Sometimes we're adding in Botox or fillers into that if someone isn't liking the way that their smile's looking. What they call bread and butter dentistry, fillings and crowns when someone has cavities and getting rid of that disease. Like I said, Botox and fillers, it can be used for both therapeutic, meaning someone's having pain like in their jaw, headaches, muscular issues, or like we think of for cosmetic purposes, someone's trying to avoid having the wrinkles, things like that. So that has its own variety that you can offer it for its uses. And then oral surgery, like I said, extraction, someone maybe has a broken tooth, typically third molars. I'm referring to our oral surgeon who comes right in house. Root canals, usually if I'm doing them at my office, it's mainly front teeth, so anterior teeth or premolars. And then most of that I'm referring to our endodontic specialist who's there just because they have they're much quicker, and they went to school for this, so they have much more extensive training and knowledge on that. Again, doesn't mean you can't do it as a general practitioner. It just all depends on what your comfort is, what your schedule looks like. So if I have the time to do it and it's going to be a while, maybe till my specialist is there, sometimes I will. Otherwise, I'm referring some of that out. And then Invisalign, that can sometimes fall into more cosmetic, or sometimes it's a functional purpose. If someone's bite is really off, they have a lot of crowding, different things that can actually affect their bite, the stress that their teeth are taking. So yes, a lot of people think of straightening out their teeth for cosmetic to have that straight, beautiful smile, but there's a huge functional component to it as well. So we do a lot of Invisalign at our office as well. And then again, we have almost every specialist that comes to our office, which is great, because anything that we are not comfortable doing, we have our specialists there for it. And it's great to have them there to utilize them, because patients love being able to stay in the office, and it's nice that, I can focus on the things that I want to focus on and I know that I'm good at, and anything that I know, I'm not as comfortable with, or a patient would be better served with a specialist, we have them there. So we have our oral surgeon, we have our endodontist who does the root canals, our periodontist, which does any gum or bone surgery, places implants. We also, some offices have a pediatric dentist. Ours does not specifically, nor do we have an orthodontist. But again, I have referrals for those when we need them there. So new technology. So there's a lot of technology that exists in dentistry. I feel like it's always changing. Research is always coming out with new technology and just new abilities, or things that are changing with existing technology. So like I talked about, the CAD CAM, or that is CEREC, is the specific machine we have. So like I said, that allows for in-office milling or those same day crowns. So that means if a patient comes in with a broken tooth, or maybe wants certain crowns done, it allows you to make them same day for that patient. You have the ability to mill bridges, in some cases dentures. We typically only stick to crowns in our office, and then we send the other things out to the lab to be done. But it's a really great technology. It allows you to do a lot of same day treatment for patients that want it. The CBCT, so that is like the 3D radiographs that people think about. So it allows you to take a 3D scan of a patient's skull, seeing where nerves are, the teeth. It's really great for guided surgeries, for implant placements. Some people use it for root canals, to either check out a tooth, or for actual like guided root canal surgeries. So it has a really wide range, and as we continue to go on, it's becoming more and more prevalent to use it, and they're figuring out more and more ways to really utilize that, because it really is helpful when you have the ability to see a 360 view of what your patient's mouth looks like on an x-ray, and being able to see all of that detail. 3D printing. So the difference between the 3D printing and the milling is that milling, you're taking basically a block and a burr and drilling it out, versus 3D printing is taking from a liquid and building up. Again, there's technology is getting better and better with the 3D printing. Some places are doing 3D printed dentures already, and I believe that it's going to keep getting better and better, to the point that, that might become, in a handful of years, that might become the commonly used way of making crowns and things like that. It'll be really neat to see where the technology goes with all of that. And then from a diagnostic standpoint, oral DNA and salivary testing, which basically allows you to test a patient's mouth and see what type of bacteria is prevalent for them. Are they at risk for periodontal disease or gum disease, different things like that, and seeing how susceptible they are allows you to better treat those patients and make a very unique profile to each person. So that's really cool technology that we have, as well as a fluorescent light that is used for oral cancer screening. So basically, it allows us to see any tissue or any areas in the mouth that are at risk of having cancer before it actually develops into a visible lesion. So I always tell patients, there's only so much I can see with the naked eye. We know once a lesion is present, it's something that we have to have checked out or biopsied. But before that happens, these screening tools allow us to see some tissue. If it looks questionable or it looks suspicious, it allows us to see that potential and can send it for a biopsy before it even gets to that point. So it's just allowing us to diagnose things earlier, better serve our patients, and make things more unique to every single person. All right, so this is one of our cases. So this was actually, I believe, a 19-year-old patient who had come into me just for a general exam, nothing related, but as you can see on that picture, her lower right side, actually in the vestibule or her soft tissue, you can see there is a lesion that she was noticing wasn't hurting her, but she's noticed it keeps coming and going. She was really unsure of, what was going on. And if you look on this x-ray, you'll notice on both sides of her jaw, you'll see these little screws. So the patient actually had jaw surgery. I believe it was like 2 or 3 years ago in Venezuela, the country that she's from. And where this lesion is starting is consistent with the screw that is on the bottom of, so the left side of the picture, which is actually her right side, it's consistent with that screw that is right there. So I actually sent her to our oral surgeon to get a biopsy of that area. And because he does jaw surgeries like this, so he has a better idea of how to treat her. Again, that's why we have our specialist there, is so that way we can work right alongside them and, utilize their skills, their knowledge to serve our patients better. So, he will be biopsying that area, basically taking a look to see if there is an infection due to the screw or due to anything with the parts, and figuring out, what needs to be done for the patient. And even though she didn't have a lesion, if we look on her left side, so the right side of the picture, the screw that looks like it's at the very bottom of the jaw, that's another area that, although she's not having an issue there, is a little bit concerning because it's so low down to the bottom of the jaw. So yeah, you see unique stuff like this all the time that maybe is not something that you exactly learned in school, but talking to the patients, finding out when stuff started, if it's hurting them, if it's growing, if they're having problems, and having your specialist there to take a look and be like, hey, what do you think this is? Or if you're unsure, utilizing them for that and asking what their opinion is, what they think you should do if you are not sure. So that's the great thing that specialists are there for, is to utilize them, not only to do procedures, but also to get their input. It helps you learn as a practitioner and get better, because the more you're seeing, the more you understand, the better that you're going to be able to serve your patients. Okay, you can go to the next one. So this one is kind of was a Botox and fillers patient. So she did not come in for dental work. And I would say the great thing about taking photos of cases is because it helps you continue to learn. So as I look at her case, I'll go into what we did and then things that I would do differently now. So the pictures on the left side were her before, and the pictures on the right side are her after. So she came in for both Botox and fillers. So you can't really see in this picture the Botox, because they're not doing the movements in this photo, but we did it. It was for cosmetic purposes. So she was not in pain or anything. But we were taking care of some of those fine lines around her eyebrows, her forehead, and her crow's feet, which are around the eyes. And then in terms of where we placed the filler, it was in what's called the nasolabial folds and the marionette lines. So if you look, especially in these first few pictures, she has a bit younger look to her. We got rid of those lines there. Now looking back for me, now that I am seeing this and have, more training, more knowledge from when I had done this case, I also probably would have added some into her cheeks to help lift that up, and maybe even the jaw to help thin it out in that area, because she was looking for that slimmer, younger look to her face. Because if you think about the reason that we would add to the cheeks is because it helps kind of lift everything up. So it's not that we need the skin pulled tighter, but as you add volume here, what happens as we age is everything kind of falls down. So that's why people complain about looking more sad or tired, is because things start to drop. So by adding filler to the cheeks and to those areas, you're kind of lifting everything up because it's pulling the skin tighter and adding volume to where you lost it. So the reason for Botox and fillers is it adds hydration and it adds volume to areas. Because again, as we age, we lose volume, we lose hydration. And that's how we simulate that younger look, is by adding back that hydration, adding back that volume. So yeah, so those were kind of very different things. One was pathology, one was, more cosmetic Botox and fillers. But again, as a dentist, you have a very wide range of what you can do in the head and neck region. So, yeah, it just allows you to have a wide range of skills and see a wide range of patients. Okay, so advice to future dentists. So, I know you guys might be sitting there applying to dental school, in the application process already, getting ready to study the DATs, and some things can seem, impossible in dental school as well. There's days, there's exams, there's things that can seem impossible, but I always say, I love that quote that everything seems impossible until it's done, because it's true. When you get to that other side and you look back and you're like, wow, I've accomplished so much. I've grown so much. Everything seems terrifying before you start it, but it's just, that experience, the practice, the time and effort that you put into it, that once you're on the other side, you can always do anything that you put your mind to. It's just putting that action into place. And then never comparing yourself to anyone except for the previous you. And that's so true now. And it's true in dental school. It's true when you get out into life, because especially in dental school, you are among everyone who, is all intelligent. Everyone, got to the same place. You are all doing the exact same thing in all the same classes together. And it's very easy to sit there and compare yourself to other people. But just knowing what you're good at, you may have to spend more time than other people on a certain class or studying or doing clinical work. But, at the end of the day, as long as you are progressing and becoming a better version of yourself every time, that's all you can do. You can only compare yourself to yourself from the day prior and the following day. Is just keep pushing forward, knowing that you're becoming a better version of yourself and not worrying about everybody else around you. And again, going back to how expensive that dental school and stuff can be, the best investment you can make is yourself. It's not the same thing having that debt from dental school as it is having all of that credit card debt. So, don't let it terrify you. Like I said, there's resources, there's plenty of things out there that if dentistry is what you really want to do, or medical school, pharmacy school, whatever you decide that you want to do, know that you're investing in yourself, and that's the best investment that you can make. And, that you will make the money back. In any profession, you can make a lot of money or no money. It just depends on if it's something you really love and the effort that you put into it. And you guys can, like I said, if you have questions after this from me directly, feel free to reach out to me on social media. That is my Instagram handle right there. I have created a TikTok, haven't done anything with it yet though. So, and I keep getting yelled at for not breaching into that realm yet, but one day, still learning.
Thank you, Dr. Sweeney. We do have a couple questions, if that's okay with you. Okay, so the first question is, how do dental schools view taking the DAT multiple times?
So, from what I still remember, they will be able to see that you took it multiple times, but if you're going to take it again, making sure, that you are really studying hard. And if you get a much better score the second time, that's what's going to matter. If they see you taking it a bunch of times and your scores are either getting worse or really not improving much, that could hurt you. But if you take, say you take it once, you don't feel you did well, you take it again and you do a lot better, that to a school is going to look a lot better, because they're going to see that improvement. They're going to see that you tried again. But again, it is important that if you are retaking it, yet you're really, studying hard, figuring out what didn't go so well the first time and really trying to improve upon that, because you don't want to see your score get worse or to really stay the same, because that's not something school wants to see. So, and also don't beat yourself up. If you got a pretty good score and you want to get a, super amazing score, sometimes it's not always worth it to go with that. I know that's something that I thought about when I got my score. I had a 20, which, like I said, was a was a good score. Definitely could have been better, but I didn't want to risk possibly getting a little worse or not doing much better. So again, looking at what your GPA is, looking at what DAT score you got, and kind of, weighing the pros and cons to taking it again. But it's not something that will reflect poorly on you for just having taken it again.
How do you balance your schedule with the nonprofit and the office?
So it can get busy, but just like anything in college, dental school, anything, it's just about, priorities and commitment. It's not too hard to balance the two jobs. It's very different in knowing what I'm walking into in each place, and just getting used to that. Every office, every place is different. Everyone that you work with is different. But for me, when I go into work, I leave work at work. It was something I had to get used to, but you still have a lot of time when you come home, and there's a lot of other things I'm involved in. So it's just, what's priorities to you. I've made time for things that I love. I still, work with a nonprofit outside of the dentistry work that I do, something on the side. I used to teach fitness classes, do workouts, do a lot of other things like that. So you have, both in dental school and once you're out working, you have time to do that stuff. In dental school, can be very tight in your schedule, but always setting aside time for what's important to you, I think, is super important, because I know for me, it makes me a more productive person because I am doing things that I enjoy. I'm not letting my life be consumed by work, or wasn't letting my life be consumed by dental school. Because, when you're in college, I always tell people everyone's always busy. You might be busy with research, volunteering, your schoolwork, all that stuff, jobs, and you're going to be just as busy in dental school. It just becomes, all of it revolves typically around school. So setting aside time for, if you are still working, or if you love hanging out with friends or going to sporting events, whatever that is, just creating that time, because you never want work or school to completely take over your life.
How do you recommend preparing for interviews beyond role playing with other people?
I think being able to know yourself well, being confident in yourself, which I know can be easier said than done, but not trying to give answers that you think the interviewers want to hear, but giving genuine answers to you. So if they ask you, why you want to be a dentist or why they should pick you, like really knowing what makes you unique, or why you really want to do something. Because like I said, they can tell the difference between passionate answers, between genuine answers, and you just giving them an answer because you think it's what they want to hear. So I think that's, across the board for any type of interview, is just knowing what you have to offer, being confident in yourself and conveying that in your answers. So even before you sit down, or maybe it's simultaneously as you're doing mock interviews with other people, is being able to sit down and reflect on things yourself, things you've done, why you want to do different things, and just being able to answer that well, because you'll go into an interview so much more confident when you have reflected on these things and know your answers, know why you feel a certain way about things, or your goals, different things like that. But don't try to fit yourself into a mold of what you think their dental student is.
What do you find most challenging about dentistry?
I would say probably just patience. They can be the best thing about it, but they can also be the most difficult thing sometimes, because everyone is super different. People might not listen to what you have to say, no matter how much you educate them on it, no matter how much you instill something into them. So they can be, the best part about dentistry, but they can also be sometimes the hardest part, because every patient is unique. No matter how much schooling, no matter how much experience you have, you're always going to see new things that you're not 100% prepared for. So yeah, I think I know it's kind of like a vague answer, but it's just dealing with people in general can be hard, just because, like I said, they not only present differently, but everyone has different attitudes, has different finances, comes from different places. So they can kind of be the best and the most challenging part about the job.
How is the work-life balance? Like, do you find every day stressful or?
Yeah, so I think it just comes back to what you make it. It's definitely something you have to work at the work life balance, because some people can go really far to either extreme. And it's really easy to do that, especially as a new grad out. You want to make money, stay busy, do different things. But at the same time, like, you need to have that balance of things that you enjoy, you know, spending time with family, eating out, whatever it might be. And again, I know this year is a little bit unique because a lot of those things weren't um, feasible or weren't open this year. But it's, again, just making time for what you enjoy, because it doesn't always come supernatural to everyone, the work life balance. And especially, I think, when you are newer and first graduate from school, it's very easy to take work home with you all the time, just in the stresses of what you're doing. But knowing that they call medicine and dentistry a practice for a reason, because you're constantly practicing medicine or practicing dentistry all the time and getting better, learning new things, challenging yourself. So it's not, yes, we want to do our best all the time, but not achieving that perfection all the time and worrying that if you're not doing something 100% perfect, taking that home with you and letting it stress you out. It's just knowing that you're doing your best, you're trying to serve your patients well, striving to do that every day. And then, when you're home, enjoying your time at home, enjoying the things that, if it's your family, the things that you enjoy doing, whatever it is, just not losing sight of that, because it's very easy to do.
What made you decide to work in a private office, and what is your favorite thing about it?
So I technically, where I work now is not a private practice. I was in private practice before, and they're all unique. The nice thing about being in private practice is um, the the schedule you set up for yourself, the procedures that you're doing. But again, it's kind of, you get that in any office, or I should say every office is different. So private practices can be amazing, corporate offices can be amazing, nonprofits can be amazing. It's all just what you're looking for. So for me, the reason I initially went into private practice is because, to be honest, in dental school, they kind of made you fearful of some of the corporate offices. And now, having like worked at both, they can be very similar. And honestly, the nice part sometimes about the more corporate offices is that the business end of things is taken care of for you. So while I was an associate in private practice, there wasn't a huge difference for me in terms of my role in the dentistry that I did. Um, it's just determined by the owner of the office. But as an owner in private practice, all of those responsibilities fall on you in terms of the business end of it. So it's not just going into work, doing dentistry, and coming home. You are dealing with, the staffing, all of, the purchasing, business end of things, taxes, finances, all of that, which is what a lot of people love and want to do. Some people don't, which is why they go into more the corporate end of things. So yeah, it's kind of figuring out what works for you. And for me, having been in all three avenues, I'm seeing what I like and don't like about all of them. So I always suggest to people, it's not a bad thing to work at multiple offices while you are early on in your career, because you'll really see what you like and don't like about each place.
Yeah. Do you have to do a lot of public speaking in dental school?
No. Honestly, you could do no, you might not have to do any public speaking at all. I know some classes might make you do like group projects or different things like that. But typically you don't have to, unless your school has some specific requirement, or if you're in maybe a leadership role, president of the class, something like that, where you have to give speeches more often. But yeah, it's not something I would have to worry about. That being said, though, as a dentist or any type of doctor, when you're in that one-on-one role, you're not in a public speaking realm, but you do have to get very comfortable of having those conversations with patients, presenting to faculty, but not necessarily in front of a big crowd.
Would you recommend taking a gap year or going straight into dental school?
I think it's a very personal decision. For me, I went directly into dental school because my concern was if I didn't, I knew how I was personally, that I was like, I don't know if I'll go to school later. If I did, whereas other people, it was the absolute perfect thing for them because they saved some money, they got some experience in other avenues. I know some people did it to strengthen their application. So I think it's really just a personal decision of what you think would work best for you. There's no wrong decision in that. I would say about half my class was straight from college into dental school, and the other half maybe took a gap year. Some people took multiple years, and some people, had been married, had kids, had different careers, and were far out of school. So there's no right or wrong way to do it. It's just finding what makes sense for you, what you think is the best for you, but don't feel pressured to do either one because there's no right or wrong.
Can you tell us a little bit about your experience being a woman in dentistry?
Yeah, so it's definitely a little different in terms of um, experience with patients sometimes, but every once in a while I might have a patient who is not used to having a female dentist, or even in dental school having professors or someone who looked at you a little bit differently as a female, especially I think it's as a young female too, that people just get unsure of your experience level, different things like that. But I think the sooner you can learn to have a ease about it, or be able to like laugh things off when people say it, the better. Because I come from the perspective that I think most of the time, not all the time, but most of the time, people aren't coming from a bad place when if they question you about it as a female, or make a joke or something. Sometimes people just aren't sure, and it's just not what they're used to. So I always just make jokes about it when I've had a patient be like, oh, like, are you the doctor? Or if I've had an older gentleman, they're like, are you sure you're going to be able to take out that tooth, sweetheart? Like, I think you need some muscles in here. I always just joke with patients, and they always end up, I've yet to have anyone, get upset with me or take it a bad way. I usually just joke about it. And I'm like, I go to the gym every day. Don't worry. I'm a lot stronger than I look, and usually those are the patients that by the end, they're like, wow, that was amazing. You were so like gentle with stuff. Like, this was great. So it's just, knowing how to not take offense to that, and learning how to kind of spin it that, you just make jokes about it or whatever. Because ultimately, I think when you get upset about it too, while people shouldn't make certain assumptions or shouldn't make certain comments, you end up being the only one that walks away frustrated and upset. So I've just learned that, I think most people aren't trying to be negative, and the ones who are, I don't know, maybe it's a jealousy thing. Maybe they're worried about women taking over. I don't know. But there, in most dental schools now, to have over 50% females that are becoming part of the class. So more and more female practitioners are out there in like every field. So I think we're going to get to the point where it is, even if not more so more so women than men. But
How did you know that dentistry was for you?
I did a lot of shadowing in high school and college of different professions, because I knew I always wanted to be somewhere in healthcare. I wasn't sure where. I knew I loved nutrition, which is why I majored in it, because I knew if I didn't do anything else, I was happy there. So I shadowed a lot of doctors, a lot of dentists, and the more I kept shadowing, the more I just really enjoyed the office space, the relationships that dentists had with their patients, the lifestyle of dentists. And I just enjoyed, teeth. I enjoyed being able to see the transformation in someone's smile, and the fact that you get to work with your hands every day. So for me, the reason I didn't end up wanting to go the route of medicine was, unless I went into a certain specialty, I wasn't going to be working with my hands every day. It was going to be more mental work, which for me, I enjoyed that hands-on approach. And I actually had a really bad experience with the dentist as a kid when I was very young. So I kind of took that as I wanted to be the opposite of what I had, and I wanted to make people feel comfortable with the dentist, make them have a really good experience. So for me, it's just where I felt really comfortable, and I knew I really liked it. The more I shadowed, the more I saw that environment.
What additional training is needed for dentists to be able to give Botox?
So it's a certification process. So some places allow you to do it in like your third or fourth year of dental school, but most places you have to be a licensed dentist, and you go to a course that has both a like presentation aspect or lecture style, and then also hands-on injection. So usually you can do it over the course of a weekend, and there's like different levels to it. But to administer Botox and fillers, you just have to have that initial certification, but there's more advanced techniques where they go more in depth into cheek fillers, lip fillers, you know, how to use it in a lot of different areas. And there's also something out there too, which kind of goes hand in hand. It's a different certification that they call PDO thread. So it's actually something that if someone's tried to use maybe a lot of fillers or Botox and they have deep set in wrinkles or acne scars, different things like that, there are these threads that actually are both smooth or what they call like barbed that can actually lift. So it kind of gives you like a mini facelift in some of those, but that's another big facial aesthetic procedure that dentists are allowed to do with training. And a lot of plastic surgeons actually use it for different procedures. So it's really neat. There's a lot of options out there, and patients who are like cosmetically driven patients typically really enjoy those type of procedures and really like the results that they can achieve with both the dentistry end of it and that. So that's the nice thing as dentists, you know, we're kind of the perfect professionals to do all this because, you know, if someone has an issue with the way that their mouth looks or the way that their lips look, you know, we can not only administer the fillers and other things, but we can also restore their smile. So they might not need as much filler in that area or treatment. Maybe it's more dentally related or vice versa.
During undergrad, would you recommend retaking a few classes again to boost your GPA or just to try to make better grades in other classes?
I think it depends on what those grades are. You know, 1C is not going to make or break you. I think in my undergrad, I think there was only one class I retook. I think it was like a economics class or something. Just because I wanted to get a better grade. And I knew I would. So I think it just depends on what those grades are. Always striving that if you have like 1 or 2 bad grades, always striving to do better in other classes. But, you know, if you think that you can definitely do a lot better by retaking that class, then sometimes it's worth it. If you're really unsure if you'll do better or not, and it was a class that you were like, whew, I thank God I made it out of there alive, then sometimes it's just better to focus on other classes versus stressing yourself out to retake that. So yeah, it can kind of go either way. I wouldn't make a habit of retaking a ton of classes because again, schools don't want to see that, but they do want, as long as you're tracking in a positive direction that your grades are getting better, or at least if you're doing well, staying consistent, that's what they want to see. So if you have, you know, 1C, it's not going to cause you not to get into dental school or med school, but you know, you don't want to be consistently getting grades like that because it definitely will impact you. But one of those is not going to tank your entire GPA.
All right. Last question. Did your dental school require you to do a semester of research?
No, they did not. I went to the University of Pittsburgh for both undergrad and dental school, and they're a very big research school, but they did not require you to do any research at all. Some schools might, but again, it's just something you have to look into. But I know University of Pittsburgh didn't. It was something that was offered if you wanted to get involved in research. And there was only a few people, I would say, in our class who were involved in research and had publications put out during dental school, but you by no means had to do that.
All right. Thank you, Dr. Sweeney.
Absolutely. Thanks for having me, guys. I hope it was helpful. If you guys have any other questions, again, feel free to reach out to me. I'm more than willing to answer your questions.
Thank you so much, Dr. Sweeney, for taking the time to build this presentation and for joining us tonight. We really appreciate it.
Absolutely. I hope you guys have, oh, go ahead.
No, go ahead. Sorry.
say, I appreciate you guys putting this together. I think it's awesome. It's definitely gonna be super helpful and informative because everyone brings a different perspective. So I'm glad you guys get to see what everyone has to offer.
All right, thank you everyone again for tuning in and joining us tonight. Kathleen is working on the quiz and she will have it up. Just a reminder, you will be able to find it on the YouTube live chat. It'll be posted there. You can also click the link in our Instagram bio and there will also be a link to the quiz there, or it will also be in the group me. And make sure you guys stay tuned for next week. There's more shattering sessions coming up. Thank you so much for joining us, everyone. And thank you so much, Dr. Sweeney, again, for taking the time tonight.
Absolutely. Take care, guys.
All right, thank you, everyone. You guys have a great night.